Hello, everyone, and welcome to another lecture of our Facts Only series. Today's topic is biotin, also known as vitamin B7. I'm Dr. Mohammed Tinawi. If you would like to know more about me, please follow the links below. Biotin or vitamin B7 is another water-soluble vitamin. We have discussed in previous episodes B1, B2, B3, B5, B6. So today we are going to discuss biotin. We rarely say vitamin B7, so most of the times I'm going to say biotin. We are going to discuss the chemistry, function, dietary sources, adequate daily intake of biotin, and then the deficiency of biotin and its effect on laboratory testing. So stay tuned, that's significant. This is the chemical structure of biotin. Like all other vitamins, it is complicated. There are several isomers. Isomers is like mirror images if you're looking in the mirror. Chemical compounds also have mirror images of themselves. So the D-biotin is the only biologically active isomer. Now, what does biotin do? Well, biotin is a coenzyme. It's an enzyme helper, so it facilitates many significant chemical reactions. It carries carbon dioxide or CO2 for several carboxylases, and those carboxylases, they add carbon to carbon bonds in humans. Therefore, carbon, as you know, is the heart and soul of us, of everything organic. So therefore, biotin is needed for the synthesis of fatty acids, for amino acids like isoleucine and valine, and also in forming new sugar, what we call gluconeogenesis. We need biotin for cell growth. And I mentioned examples of some of those carboxylases if you're really into biochemistry. Fortunately, we can find biotin everywhere. Well, some bacteria in our gut can make it, but you can find it in many plants, in yeast, in soybeans, sweet potatoes, spinach, broccoli, many seeds as well, almonds and walnuts. Also, you can find it in eggs, milk, yogurt, cheddar cheese, salmon, tuna, beef, and liver. There is no recommended daily intake of biotin or B7. We don't know exactly how much we need, so we are going to call it adequate daily intake. This intake is in micrograms, not milligrams like with other vitamins. And remember that 1 milligram equals 1,000 micrograms. So the amount we need is really tiny. For children, it's enough to have 8 to 12 microgram of biotin. For adults, maybe it's about 30. And there's no toxicity. The excess will go into the urine. It's excreted in the kidneys. And if you eat something that has a lot of biotin and you don't absorb it, well, it goes through the stool. So there's no documented biotin toxicity. What happens if you don't have enough biotin? Well, that's rare. It used to happen in people on total parenteral nutrition or TPN. When patients are in the hospital, they can't eat, we give them nutrition through the vein. It's called TPN. In the past, they did not add biotin, and therefore they used to see biotin deficiency. So now we don't see that. Some people who are, for some whatever bizarre reason, digest a big amount of raw egg whites can have biotin deficiency. Why? Because egg whites have avidin, and when you don't cook it, this avidin is going to prevent biotin absorption. There's no reason to digest raw egg whites. You can get salmonella, and moreover, it's a very complex protein, and you're not going to digest it. Anyway, the manifestations of biotin deficiency are conjunctivitis, so the eyes become congested, become red, alopecia, which is hair loss, dermatitis, which is a redness, as you can see in the picture, around the eyes, around the nose, around the mouth, and some neurological manifestations, lethargy, hallucinations, and paresthesia, which is numbness and tingling in the hands and feet. Now, someone might ask, should I take biotin if I have hair loss? Will that help? The answer is probably not. Uh, Another question, should I take biotin if I have brittle nails, if I have problems with brittle hair, etc.? Well, there's no benefit either, unless you have biotin deficiency, which is rare. So there are no benefits to these biotin supplements. Now, in people who take pharmacological doses of biotin, and like I said, this is rarely beneficial, the doses can be big, can be 5 milligrams a day. And we said that the recommended dose is 30 microgram. So here you have someone taking a lot more than what they need. So in that case, the biotin can interfere with many important laboratory tests like thyroid test. It can give the appearance that the patient has Graves' disease or hyperthyroidism. This is a diagnosis you really don't want. It can interfere with troponin, which is the test to exclude heart attacks, myocardial infarction. Digoxin, a common medicine, especially in the past, for congestive heart failure. Ferritin, a test we used for iron stores. Testosterone, you know what that is. And NT-proBNP, which is a test we use to determine if the patient has fluid overload. And I cannot really tell you what biotin is going to do. It can make that test appear elevated, high, or even low. So it is recommended to hold the biotin for 48 to 72 hours prior to testing, or at least inform the laboratory or the physician. I'm going to end here. See you in the next lecture.